In every country, the National Red Cross or Red Crescent Society works energetically to build the long-term capacities of communities. This process involves communities identifying their needs, volunteers offering their time, staff coordinating resources, and domestic and international partners providing support where necessary. Ultimately, it helps the vulnerable better manage their lives, reduce the risks they face, and improve their long-term health, well-being, and livelihoods. This video is one of 5 documentaries created to illustrate best practices in building community and Red Cross and Red Crescent capacities in a variety of cultural contexts from Mongolia, Australia, Nepal, and Cambodia. The Red Cross and Red Crescent societies mobilize people at community level to improve the lives of the vulnerable by involving them in planning services that meet their own identified needs and building their long-term strengths to manage themselves. A good national planning process begins with communities identifying the improved lives they would like to lead. Branches then mobilize and train volunteers from those communities who can also work with other organizations and local agencies to meet these needs. The national headquarters of the Red Cross or Red Crescent Society then organizes a long-term national plan, having listened to and included all the local needs. The headquarters helps branches share successful solutions across the country and also helps raise national funds to meet any gaps if branches can't raise all their funds locally. In Nepal, the Red Cross has been working with communities to better understand their needs and the roles of branches to support them. In the eastern part of the country, in this farming community of Barol, community member Jit Bahadur Thapa believes the lack of awareness is the root cause for most problems.
Now there is no drinking water. When there is no drinking water, people drink water from all sources without putting any drops or tablets or without filtering. For treatment, if they become sick, they don't go to a hospital. Die at home. There is no money. If there were self-help programs, that might have been something. There should be training about health. Training on first aid is very essential.
With many types of vulnerabilities to tackle at the same time, there is a need to address a wider concept of community development linked to branch volunteers with relevant skills to tackle local needs.
By teaching tailoring and knitting, the women have started to earn a living and can make 300 to 400 rupees a day. They don't have to do the traditional free labor. By making tube wells in places where there was no water, people have been able to drink water. People have started taking training at our Red Cross office. The most pleasing thing is that people who used to hide before now join in when they see other people discuss various issues, chatting, sitting together, taking advice. This is the most pleasing thing.
Forming village-level communities closely linked to the Red Cross branch is an approach used by the Red Cross, even in the most remote villages of Nepal.
We formed a committee and prepared a proposal about the need for cleanliness and hygiene, and we proposed to run it through the Red Cross. We identified the problems first, and we realized that we should run these projects in a uniform and unified manner through Red Cross.
The strong relationship between the village committee and the branch is a crucial factor of success.
Our sub-branch always coordinates with the community or discusses it with them when doing any work. For example, if you look behind me, there's a women's group. We formed this women's group 2 years ago with the consent of the community. In that group, at the beginning, they said, "We are not educated. We don't know how to read and write." So after that, we conducted informal education classes for 6 months. After conducting these classes, the women developed a habit of saving. So we have formed a saving cooperative for them. And now they save. They save monthly. They save 21 rupees a month. There are 51 women and no men in the group. And they invest that money in the village itself at a low interest rate. The same group conducts cleanliness campaigns. It has always been running programs for clean drinking water and sanitation. The sub-branch always asks the people from the community before doing any programs in the village.
The empowerment of the local community resulted in them identifying some clear roles, which their local Red Cross branch could play to help them improve further.
We also incorporated needs assessment and the process of evaluation in the community. The other reason is transparency. I think the feeling of ownership towards the program helps to make it a success. We conducted various trainings for capacity building like accounts and leadership development. These also contributed to its success.
3 years after this process started, the communities, as well as the Red Cross volunteers who had worked on the program, have many positive lessons to share.
Members of my family used to suffer from diarrhea frequently. We didn't even know that we had to take rehydrating drinks when we got diarrhea. No one from our family has suffered from it in the past 3 years. We also know that we should make smoke-free stoves so we don't suffer from respiratory diseases.
There have been many important changes in the community, with new relationships built between people and stronger branch involvement in building harmonious communities. Women, such as Mrs. Badumi Chowdhury from the untouchable class, now freely mixes with other women in her village at a monthly credit cooperative.
Earlier, we did not know anything. We did not know anything about Red Cross. We did not know any people. We could not even do namaskar like this. Now, after some training with the Red Cross, we have started to understand various things little by little. After we came back from the 7-day training course, we formed a savings cooperative. We called a meeting, formed a group, and from that day on, we started collecting money. Now, if any problem comes, we take the money from this cooperative to solve it.
This investment in community and branch development paid off in August 2008, when 60,000 Nepalese families became flood victims when the Koshi River overflowed its banks. The local district chapters in Nepal went to work immediately, mobilizing volunteers to provide relief supplies to the victims. They also coordinated with local and international organizations.
Our programs start at grassroots levels instead of being forced onto the community from above. We have to study what the needs of the community are, and we also have to think about what kind of projects will actually help them achieve far-reaching development. We discuss this with the community, and only then do we run our projects.
Consultation with the community is important for the development of Red Cross branches.
Our sub-branch has trained many volunteers who act as a bridge between the community and the branch. The sub-branch is pro-women, pro-vulnerable families, and very effective. And it has also become very capable compared to the past. Our volunteers have worked as volunteers for a long time. This way, the community is making the sub-branch stronger.
In Mongolia, the Red Cross has strengthened its consultation with vulnerable people about their needs. A single mother of 3 children speaks about the hardship she was facing before the Red Cross asked her what she needed.
I relocated to Ulaanbaatar in 1999. It was difficult for me to find work in the countryside as I was raising my 3 children. The purpose of my relocation to Ulaanbaatar was to find new work. I was renting a ghare. However, I could not afford to purchase the coal and wood for the fire. By this time, it was very difficult for me, with no migration documentation, no place of residence of my own. My children couldn't register at the local school. I didn't know who to apply to for help and support.
As this volunteer explains, faced with many similar stories, the Red Cross decided to act to help people gain their rights, as well as basic needs.
Oinchimeg is a single mother who works as a duty staff in residential buildings. Since she didn't have a place of her own, she used to live in a small room in the basement of the residential building where she worked with her family. After taking into consideration her situation, I talked with our branch secretary and we decided to include her in our ghare project. So we presented her with a ghare, which she now lives in with her family.
Identifying the most vulnerable in the community, such as single mothers, is not easy and often requires volunteers to go from house to house.
Since they have no permanent address and personal identification, our Red Cross volunteers assist them with obtaining the proper documentation. Through our Red Cross branch, we conduct house-to-house surveys to find out the vulnerable groups in our community and visit their homes and provide whatever support they require.
Many single elderly people also live in isolation. Often they are not registered with the government or any other organization. A Red Cross volunteer from Bayan Suk branch explains that research is necessary for her to help identify the most vulnerable.
I found this elderly man, Biambasuran, who's now 86 years old and lives alone. I visit him twice a month. I help get him to a doctor to check his health, bring water, bring firewood from the branch if it has run out, and sometimes I cut his hair. If he doesn't get his pension by a certain time, I help him to get it. It's important to keep up-to-date research notes on vulnerable people by visiting them in their homes.
By consulting branches regularly about their priorities for the most vulnerable, the national level office helped to draw up an action plan to serve these vulnerable people.
Mongolia Red Cross has 37 mid-level and 902 primary-level Red Cross branches. As the National Red Cross organization, we conduct meetings with all mid-level branch volunteers and beneficiaries on a quarterly basis. We visit branch secretaries, volunteers, and beneficiaries each month.
To ensure that beneficiaries are making progress, volunteers make regular checks on their health, psychological state, clothing, and nutrition.
Volunteers visit our beneficiaries twice or 3 times a month and conduct a meeting once a month to discuss the data gathered. We keep note of our beneficiaries with the help of our volunteers.
Beneficiaries themselves are also invited to make suggestions to help improve services.
One beneficiary lives with her 4 grandchildren. Another one lives with his bedridden and disabled wife. We take a record of the satisfaction of the beneficiary. This process is called the Beneficiary Satisfaction Survey. Just as I said before, it's about the problems our beneficiaries face and how the problems are solved to the point the beneficiary is satisfied.
Building relationships between volunteers and vulnerable people within their own communities strengthen the vulnerable people, the branch, and the community at the same time. Strengthened relationships between people at community level are at the heart of effective branch development. 86-year-old Bayan Basuran, a retired military officer, now living in Bayan Suk district, is encouraged to ask the Red Cross for any help he may need to lead a more comfortable life.
Kanda from the Red Cross is the only person who helps me. I didn't even have a light switch. She brought it for me. In my opinion, participating in Red Cross activities has helped me to live further. Kanda isn't my kin. She's from Kovt province. I'm from Zafkan province. We didn't know each other before meeting through the Red Cross. Sometimes I ask her to bring me medicine, and she brings it.
The Australian Red Cross has always stressed communication with vulnerable communities as a vital part of its operation. The Red Cross can be a place that unites people. 22-year-old Flora Fakira is an immigrant from Sudan. She speaks of her experience where she is a youth volunteer involved in the World Aware program.
We came to Perth 7 years ago and life wasn't easy. Red Cross helped me a lot because when they came to ask us what is happening in the community and what we want to do, and we told them the problem, and then they started running a workshop for us, a leadership workshop last year for the Sudanese community. It makes my life better and my family's life better because I was going through depression of losing my family and leaving my hometown, you know. It wasn't easy. But they were there for me to get me through it.
Empowering people, in this case isolated young people, is a key way in which the Red Cross can contribute to stronger communities and stronger community involvement in their local branches. Youth Development Officer in Perth, Melissa Hurd, expands on this and how the World Aware programme came about.
World Aware had an interesting beginning because it started as being part of a fundraising project that we were working on with the Sudanese community. And we set up a community meeting and didn't have any young people come along to it. It sort of identified straight away that there weren't really many sort of youth leaders in that community, and by talking to a couple of other community leaders, we sort of thought, why don't we put something together to address this? And we set about quite a long process of going to schools, going to different community groups and talking with young people about what they would like to see in a program, what kind of activities would get them excited and actually wanting to be a part of it. And through that consultation, we put together the first year of World Aware.
The Red Cross role is to find those who others haven't been able to help and make a difference in their lives.
I had a pretty rough childhood. My mum and dad were together for about 25 years. And then my dad did a workplace injury that caused him to be disabled. Dad came a bit aggressive. I moved out of home at the age of 13. Then I fell pregnant and Department of Community Services had came into our lives due to they thought there was domestic violence occurring in the relationship. And I've been here for 8 months so far. Got to do it because if you don't, you lose one of the most important things in your life.
One of the Australian Red Cross's main priorities has been to involve more people from new vulnerable groups. The aim is to ensure that branches are strengthened by listening to their views and involving them as new volunteers.
How we're going to change our services is actually a program of renewal that we're now entering, which is to actually go through all of our existing services, have a look at those services that really target those areas of disadvantage and those most marginalised people, build on and keep those programs that do that, but start to develop new service responses for communities and groups that we really aren't properly working with at the moment. That needs to be a process of engaging with those communities, actually talking to those communities about what they need, what sorts of supports they need, looking at the strengths Red Cross have, what we can offer, and then working in partnership with those communities to develop new programs and new responses to their needs.
As with other national societies, Australia Red Cross found ways to strengthen how it listens to different groups.
The development of a youth advisory committee was the first step in targeting vulnerable young people in Western Australia, because without a youth advisory body, it was difficult to know who actually needed helping and the best ways in which to help young people. So by going out to those communities and seeing what they thought was necessary, we were able to develop a program which was aimed at specifically at young people in new and emerging communities in Western Australia, which was World Aware.
To review its relevance to new vulnerable groups in Australia after 94 years of existence, the Red Cross recently conducted a top-to-bottom review of its entire operations.
It was really holding a mirror up to the organisation and its work. As a result of that review, it was clear to us that there were many critical, marginalised and vulnerable groups in the community who were simply not being addressed by Red Cross services and programs. So we're
Cambodia Red Cross has prioritised the capacity building of communities and its branches, set against the historical landscape of war and genocide. The HIV/AIDS programme is an example of addressing an issue that has been in the community for some time without people knowing. The Cambodian Red Cross involves community-level volunteers who come from affected families and who both build the community as well as the branch's strength. These are the stories of 2 Red Cross volunteers from one of these communities.
So I asked for help from the Red Cross HIV/AIDS program and was assigned as a volunteer based in Chong Krel commune, which is my residential commune. I'm responsible for taking care of patients such as children living with HIV/AIDS and victims of disasters. Now the situation is getting better and community members are quite happy to have me as a person living with HIV/AIDS. I'm able to help other people living with HIV/AIDS, especially the new ones who dare not show their identities.
I contracted HIV/AIDS in 1999. I'm a person living with HIV/AIDS. At that time, there were no people living with HIV/AIDS who dared show their identities, so I was the first one to reveal my identity. I was also the first person to experience the use of antiretroviral drugs. The Red Cross branch was interested in me because I revealed the truth, and I also worked as a civil servant. So the branch recruited me as a volunteer, and I've been there from that time till now. When people living with HIV/AIDS have problems, I bring them to our peer support center and also help them to access services such as blood tests. If the test is positive, then I take them to get antiretroviral drugs. So many community members know me. Now in my community, I can mobilize resources. We have funds for helping people living with HIV/AIDS. We now have 2.8 million reals to help them when they have problems.
Similarly, the remarkable progress of Red Cross branches in Cambodia can be attributed to these trained community volunteers. The Battambang branch president, His Excellency Buth Kin Sian, touches on the connection between strong branches and strong communities.
After creating branches and sub-branches and building our volunteer network, we started to provide volunteers with training on working conditions, Cambodian laws, and the Red Cross 7 fundamental principles, amongst others.
We asked Yusa Kun, head of Kampot's provincial HIV/AIDS office, whether she thought the Red Cross was strong.
On the whole, Cambodian Red Cross has had good collaboration with the Provincial Health Department and other relevant departments in its effort to fight HIV/AIDS. The Red Cross is an important agent to support people living with HIV/AIDS, living in remote areas which are not accessible to some NGOs.
The Red Cross and Red Crescent is present in a wider number of communities than any other voluntary institution across the world. By listening actively to vulnerable people and planning services with their say, stronger communities are built, and in turn offer their strengths as volunteers and resource people to build stronger branches.